the Crane Room for your lunch and dinner rendezvous. You'll enjoy their pleasant atmosphere. The Crane Room takes pride in their wide variety menu. Appetizers, sandwiches, soups, salads, entrees, pasta, and the best burgers in town. Newcastle's best selection of domestic, import, and craft beers from around the world, and the Crane Room features a 35-tap draft system. Ask about their daily specials that will please you every time. The Crane Room is located at 3009 Wilmington Road in Neshannock Township. Call 724-656-1553.
Let's talk with Norm.
We're with
Norm Lutton.
Norm, you're the owner of Crazy Car Restoration. Why don't you tell us a little bit about that?
Well, it's a new company we're opening up. Originally, we was Lutton Auto Repair, and we're adding on a little bit. And we're trying to bring out some custom cars for people somewhere in between the $5,000 and $20,000 range, what people can actually afford today. Anymore, you know, all these cars are so expensive. We're just trying to make ends meet for other people.
That sounds great now.
But I've been fixing cars for over 35 years.
That's great.
So when you have a repair, big or small, call Norm.
Hi friends, I'm Gary West, and whether you find Augustine's Pizza at your local grocery store or at their restaurant in Newcastle, the folks at Augustine's Pizza hope that their pizza is always your first choice for any and all occasions. Bill's Bake Shop will make you happy. Bill Cast is the owner, and he and his staff keep the tradition going with all those bakery items that you remember as a kid. Just to name a few items, Bill makes cream sticks, cinnamon rolls, bear claws, cream horns, cannoli, cakes, pies, cookies, bread, pizza, and so much more. Bill's Bake Shop, located at 228 North Liberty Street in the Mahoningtown section of Newcastle, is open Tuesday through Saturday, 7 to 5, and Sunday, 7 to 2, closed on Monday. Bill's, where smiles are everywhere. Call 724-654-4223.
2P, Gifts and Thrifts, Many Treasures. Now let's talk with one of the owners. Hi, this is NCTV45, and your name is?
Paula Mandaglio.
Paula, pleased to meet you. Can you tell us a little bit about 2Ps, Gifts and Thrifts?
Absolutely. Our thrifts and gifts. We do high-end thrift items, personalized gifts, and repurposed furniture.
We're going to catch up with Peggy.
Sure.
Is
Peggy Cousins.
And can you tell us a little bit about thrifts and gifts? 2P. You have giftware.
Uh-huh.
And I see the kids' clothes.
Mm-hmm.
You're a mini department store.
Correct.
There you go. Well,
We have something for everyone.
2P, Gifts and Thrifts. The Beanery Depot and Deli. Coffee, made-to-order subs, snacks, and more. Meatball sandwiches, fresh and hot. Pepperoni rolls, fish sandwiches, chicken, milkshakes. The Beanery Deli. When you're hungry for something special, and it won't cost you a lot of beans.
This is NCTV45. You can watch us anytime on your time.
Hi, I'm Gary West for NCTV45, and this is another segment of Focus NC. And this is segment 3 of a 3-parter. My guest is Dr. John Wrightson. Welcome, Doctor.
Hi, Gary. Thank you.
Good to have you back. So much to talk about in the field of medicine that he's in, and we want you to call 724-598-2280 if you have any questions about pain management. And his office is at 3212 Wilmington Road in the Neshannock Township area of Newcastle, and it's Joshua Son Rehabilitation and Pain Management. And he told me earlier in segment 1 that he named it after his son. Well, Dr. Wrightson, we always hear about people that are confused about insurance. So why don't you give us some common questions that you get asked by your patients about insurance.
Sure. Well, the first I'll say is that I can understand patients' confusion because it confuses us, and we deal with it every day. And it seems like every time we turn around, something in insurance is changing almost as rapidly as the wind changes direction. And probably one of the most common questions we get are with regards to a patient copay and so forth. You know, do I owe a copay for this? And that can even become confusing because patients, some insurance plans that patients have may have very large deductibles. So copays for those patients actually aren't even applicable until after the patient has met their deductible, which now with the onset of Obamacare and all the changes that have sort of trickled down into all of the other insurances, it can be quite substantial. Sometimes patients are paying $5,000 deductibles, maybe $7,500 deductibles, sometimes even more. So, you know, a lot of patients are now making choices as to what services they want, not based on their necessity or based on whether they will help them or not, but whether they can afford it or not.
Do you accept most insurance plans?
Yes, we do.
Do you handle workers' compensation?
We do, yes.
Percentage maybe of how many compared to your other patients?
Probably workers' comp and auto injuries probably account for a good 10% of our practice, maybe 15%. So it's a fairly sizable number.
Now, in the other segments, we talked a lot about pain management, the different techniques that Dr. Wrightson uses. But I did want to ask you about kidney stones. Kidney stone pain has got to be one of the worst types of pain there is. Is there any treatment for that?
Well, I can empathize with people that have kidney stones because I've had one, and
Me too.
They are miserable.
They are.
Anybody that's had one, I've had women come in and say they'd rather go through childbirth again than to deliver a kidney stone. You know, typically your average run-of-the-mill kidney stone will require not a lot of treatment. Usually some pain medication, a lot of hydration, and so forth, and the kidney stone eventually will pass. Now there are patients that have kidney stones that are large and may have trouble passing and can actually obstruct urinary flow through the ureters from the kidney to the bladder, that require what we call stenting, where a flexible catheter is placed into the ureter so that urine can pass, and hopefully the stone through the catheter into the kidneys, and then it can pass from there. So that sometimes may be a treatment. And in very difficult cases, patients can either go through lithotripsy.
That pulverizes it.
Correct.
Yeah.
Or even lasers treatments.
Now, you touched on this next subject in the other segment, and I promised everybody we were going to talk a little bit more about it. What type of implant devices are there, and do you use them in your practice?
Yes, we deal with two types of implantable devices. The first is called an intrathecal drug delivery system, otherwise known as a pain pump, and the second is a spinal cord stimulator system. Generally, the implantable pain pumps are used either for patients that have spasticity from traumatic brain or spinal cord injuries, or for patients that have, for example, multiple sclerosis. And for those patients, typically we'll place baclofen into the pump because that reduces muscle spasms and so forth. And the other subset of patients is patients that have chronic pain. And the largest number of patients that we use these implantable pain pumps on are for patients that have had back surgeries that have failed and have primarily low back pain. So these devices can be implanted into the patient so that instead of having to take just multitudes of pain pills throughout the day and have to live with all of these side effects like sedation, drowsiness, itching, sweating, constipation, nausea, all of those kinds of things, we can implant the pain pump and use far lower doses of pain medication that can be targeted or delivered to specific target areas that correspond to where the patients have pain, and so they don't have to take all those medications by mouth, and the efficacy of the pain relief is much, much greater.
Are they usually implanted in the abdomen, and are they cosmetically pleasing?
They're implanted, they can be implanted either in the abdomen or the buttock. Typically, they're not, it's about the size of a hockey puck. So you can imagine a hockey puck placed under your skin. It's going to be observable. However, I tell my patients one of two things. If we put it in your abdomen, you could wear a one-piece bathing suit if it's a woman, or if it's a male, you really don't care. We're not that vain, most of us. And if we put it in the over the gluteal or in the buttock area, the only way somebody was going to see it is if people ran around without their pants and underwear on outside, and that usually only happens in very select conditions.
Well, if it's going to help them, they're not going to care, right?
Exactly.
Yeah. Well, we're running out of time. Just a couple more quick questions for Dr. John Wrightson. Dr. John, what are your thoughts on acupuncture for pain management?
I actually have had acupuncture done about 20 years ago or so, when I had a pinched nerve in my back and sciatica, and it helped me. The thing about acupuncture is it will help some people, and other people it will not help, just like any other form of medical treatment. So, and the other thing patients should know about acupuncture is some insurance companies cover it and some don't, and the cost of the procedure can be reasonable to ridiculous. So I would advise any patients that are interested in having it done, shop around first.
Why are doctors who specialize in pain management often anesthesiologists?
Well, the field of pain medicine many years ago was actually started by anesthesiologists, and typically the purview and purpose of anesthesiologists is to treat and prevent pain. So the treatment of chronic pain was sort of a natural adjunct to that. But over recent years, more and more physiatrists such as myself have also been getting involved in the pain management setting, and feel that our knowledge of the neurologic and musculoskeletal system and our ability to diagnose, appropriately diagnose patients goes a long way toward more effectively treating them.
And I do have one more question for you. And I want to preface by saying I'm very impressed with your credentials and your experience. You're very knowledgeable in your field. I need to know if you've authored any articles or books.
Yes, actually I have authored a few journal articles, and I have authored one book chapter in state-of-the-art reviews for physical medicine rehabilitation, and co-authored a book chapter for a book called Whiplash. So in treatment of whiplash injuries, but also co-authored an article on treatment and diagnosis of elbow, wrist, hand injuries as well. And in that particular book, we actually investigated all of the specific tests to diagnose these injuries. And I actually went back into literature that was actually authored back in the late 1800s to find some of the information that I came up with on some of these tests. So it was very interesting.
Well, it's Dr. John Wrightson from the Joshua Son Rehabilitation and Pain Management Office, located at 3212 Wilmington Road in Neshannock Township. Call 724-598-2280. And that website address, Doctor?
www.joshuasonrehab.com.
And their hours, Monday through Friday, 8 a.m. to 5 p.m. Well, it's been very enlightening and a pleasure having a conversation with you. Keep up the good work. Thank you so much for coming in on Focus NC. And remember, we got three parts. This is segment 3, and make sure you check out parts 1 and 2. That's it for Focus NC. I'm Gary West for NCTV45. We have a great relationship with Main Street Clothiers and Custom Tailors in downtown Newcastle at 210 East Washington Street. And whenever you watch Focus NC, my wardrobe is furnished by Main Street Clothiers and Custom Tailors.
Dan's Auto Body and Repair. Daniel McClure says we do complete paint jobs using Sherman-Williams Ultra 700. Minor fender benders, no problem. Free estimates, frame straightening, and rust repair. Competitive pricing on bodywork. We waive the deductible. Visit our website for information on insurance myths. We also do collision. Visit dansautobodyrepair.com or 724-657-3647. Quiet, relaxing tranquility. That's Bethy's Bakery and Eatery in Volant, Pennsylvania. But you may ask, is it a bakery or is it a restaurant? Bakery, restaurant. Well, they have cakes of every kind. And not only that, they have burgers also, and turnovers, and salads, and donuts, and nachos, and cupcakes, and cream puffs, and just goes on and on. But let's not forget, home of the plate-sized cinnamon roll. Is it a bakery? Is it a restaurant? You decide. Bethy's in Vogue. McCree Sports, 835 Moravia Street, wants you to be on top of your game. Go to McCree Sports for all your sporting needs. You can call them at 724-654-6065. McCree Sports. They'll make you shine.
It's Little Johnny's Pizza 2 in downtown Newcastle with a great variety menu that you will tell everybody about. Chris Quiera, the owner, is here with more information.
Stop down and see us at Little Johnny's 2. We're located at 130 East Washington Street, or give us a call at 724-657-2210.
It's Butts Flowers when you want a wide variety of flowers for any occasion. They also have a selection of fine gifts and more. Butts Flowers is conveniently located in downtown Newcastle at 120 East Washington Street. Call Butts Flowers at 724-652-7727 or toll free from anywhere, 1-800-443-7726. It's Butts Flowers in downtown Newcastle. Make it Lanigan's Irish Pub, where you'll be amazed with the weekly specials. Pub grub, salads, burgers, sandwiches, Irish specialties, and desserts. Lanigan's has a full bar featuring domestic, craft, and Irish draft beer. You can also book a party at Lanigan's at 126 East Washington Street in downtown Newcastle. As they say at Lanigan's Irish Pub, the best Irish food since Ireland. Call 724-657-3444.
Talk about convenient. Located just off the 422 bypass. On Center Avenue, Kaito's Restaurant, Catering, and Banquet Center is perfect for parties or business meetings. Spacious and contemporary, they feature large portions at low prices. Make Kaito's your choice. Call 724-535-3530.
This is NCTV 45. You can watch us anytime on your time.